Stroke is the third largest cause of death in the UK. It costs the NHS over £2 billion per year. Approximately 1 in 5 acute hospital beds are occupied by stroke victims.
Atrial fibrillation can easily be diagnosed using an ECG test. Within the NHS, most ECG tests are undertaken in large acute hospitals. This requires the patient to attend hospital at a specified time. It requires specialist staff to collect the ECG recordings and consultant cardiologists to diagnose the results.
We have developed a device that enables ECG measurements to be recorded from patients in the sitting position much more quickly than existing techniques. This device lends itself to use in GP surgeries, where GPs could rapidly screen their patients for atrial fibrillation. The device has been tested in this centre on over 150 patients. The results of these trials showed high levels of sensitivity and specificity for the diagnosis of atrial fibrillation. Recent studies have shown that if GPs were to screen their elderly patients, they could reduce the number of strokes in the UK by up to 9,000. £25,000 would enable us to develop algorithms to automatically detect atrial fibrillation from our new ECG interface. £100,000 would enable us to develop prototype hardware and trial the devices in GP clinics.
The concept is protected by international patent applications. Further investment would enable us to move ECG testing to the primary care setting.